I've had instances where there's one in particular, a patient had an HAE attack, ended up in the hospital in the ICU, intubated, which is a common thing for HAE patients. And we were able to get drugs sent to the hospital that day. That was a really big team effort with the clinical educator and myself and the pharmacy, working together to ensure that this patient who had a real need, a life-threatening um, emergency, and we were able to get medication to him that day. Um, that was a really heartfelt moment for us as a team to just be able to know that we were able to get something that could potentially save his life. And so I think as that's something that always sticks with you, throughout just every day when you're working, and it may not always be that dramatic, but you know that it can be that big of an impact. So making sure that we get this as quickly as possible to the patients that need it's why we show up every day.
Indications and important safety information. Indications. Sagizere, icatibant injection is indicated for the treatment of acute attacks of hereditary angioedema, HAE, in adults 18 years of age and older. Important safety information. Warnings and precautions. Laryngeal attacks. Given the potential for airway obstruction during acute laryngeal HAE attacks, patients should be advised to seek medical attention in an appropriate healthcare facility immediately, in addition to treatment with Sagizere. Adverse reactions. The most commonly reported adverse reactions were injection site reactions, which occurred in almost all patients, 97%, in clinical trials. Other common adverse reactions occurring in greater than 1% of patients included pyrexia, 4%, transaminase increase, 4%, dizziness, 3%, and rash. Post-marketing experience. The following adverse reactions have been identified during post-approval use of icatibant, urticaria. Drug interactions, ACE inhibitors. Icatibant is a bradykinin B2 receptor antagonist, and thereby has the potential to have a pharmacodynamic interaction with ACE inhibitors where icatibant may attenuate the antihypertensive effect of ACE inhibitors. Clinical trials to date have excluded subjects taking ACE inhibitors. Use in specific populations, pregnancy. Available data from published literature and the pharmacovigilance database with icatibant use in pregnant women have not identified a drug-associated risk of major birth defects, miscarriage, or adverse maternal or fetal outcomes. Lactation. The developmental and health benefits of breastfeeding should be considered along with the mother's clinical need for icatibant and any potential adverse effects on the breastfed child from icatibant or from the underlying maternal condition. Pediatric use. Safety and effectiveness in pediatric patients below the age of 18 years have not been established. Geriatric use. Elderly patients are likely to have increased systemic exposure to icatibant injection compared to younger, 18 to 45 years, patients. No dose adjustment is recommended. For more detailed information, please refer to the full prescribing information at sagicere.com/PI. To report suspected adverse reactions, contact Cycle Pharmaceuticals at 1-800-836-4380 or the FDA at 1-800-FDA-1088 or www.fda.gov/medwatch.